1. When administering ceftriaxone sodium IV to a client before surgery, which assessment finding requires immediate intervention by the nurse? A. Nausea. B. Stridor. C. Headache. D. Pruritus.
The correct answer is stridor explanation. Stridor is a high-pitched, wheezing sound resulting from obstruction of airflow in the upper airway. It is a serious and life-threatening symptom that indicates potential airway compromise, often caused by an anaphylactic reaction or severe hypersensitivity to the medication, in this case, ceftriaxone sodium. When stridor occurs, it requires immediate intervention as it can rapidly progress to complete airway obstruction, making it a medical emergency.
2. Before administering the initial dose of sumatriptan succinate to a client with a migraine headache, it is most important to determine if the client's history includes which problem? A. Coronary artery disease. B. Seasonal allergic rhinitis. C. Type 2. Diabetes mellitus. D. Irritable bowel syndrome.
The correct answer is coronary artery disease. Explanation: sumatriptan succinate is a selective serotonin receptor agonist, 5-HT1 receptor agonist, used to treat migraines. It works by causing vasoconstriction of blood vessels in the brain. While effective for migraine relief, this vasoconstriction can also affect coronary arteries, potentially causing serious cardiovascular complications in individuals with coronary artery disease, KD, or other cardiovascular conditions.
3. A healthcare provider prescribes the anticoagulant heparin for a client with a pulmonary embolism. Before initiating the medication, the nurse should ensure that which drug is readily available in case of heparin overdose? A. Warfarin. B. Vitamin K. C. Protamine sulfate. D. Diphenhydramine, HCl.
Correct answer: protamine sulfate. Explanation: protamine sulfate is the specific antidote for heparin overdose. Heparin is an anticoagulant that increases the risk of bleeding by inhibiting clot formation. In cases where a client develops excessive anticoagulation or bleeding due to heparin therapy, it is crucial to have protamine sulfate readily available to reverse heparin's effects.
4. An increase in which serum lab value indicates to the nurse that a prescription for atorvastatin is having the desired effect for a client at risk for coronary artery disease? A. Low-density lipoprotein, LDL. B. Prothrombin time, PT. C. Creatine phosphokinase, CK. D. High-density lipoprotein, HDL.
The correct answer is high-density lipoprotein, HDL. Explanation: atorvastatin is a medication belonging to the class of drugs known as statins or HMG-CoA reductase inhibitors. It is commonly prescribed to lower cholesterol levels in the blood, thereby reducing the risk of coronary artery disease, CAD, and other cardiovascular events such as heart attacks and strokes.
5. A daily dose of aspirin 325 milligrams per oral is most beneficial for an adult client with which medical diagnosis? A. Gout. B. Sepsis. C. Myocardial infarction. D. Rheumatoid arthritis.
Correct answer: myocardial infarction. Explanation: a daily dose of aspirin 325 milligrams is commonly prescribed to prevent blood clot formation in clients at risk of myocardial infarction, MI, or other cardiovascular events. Aspirin exerts its benefit by irreversibly inhibiting the enzymes cyclooxygenase, COX1 and COX2, which reduces the production of thromboxane A2, a substance that promotes platelet aggregation. This antiplatelet effect helps prevent the formation of clots that can obstruct coronary arteries, reducing the risk of subsequent heart attacks.
Explore the full list of questions and a wide range of nursing quizzes at acenursingexam.com. For just $57 per month, gain unlimited access to all practice exams, complete with comprehensive explanations provided for each question at the end of every quiz. Joke of the day. What did the nurse say to the bottle of acetaminophen? "You're such a pain reliever."